Welcome to Middlesex Moments, coming to you from Middlesex Community College's Center for New Media. I'm Steve Minkler, the college CEO, and with me today is my guest, Dr. Sara Frawley, who is a doctor of naturopathic medicine. Thank you for being my guest today, Sara.
Thank you for having me.
So for our listeners' benefit, tell us a little bit about what naturopathic medicine is.
Sure. So it's, let me start with how we go to school. I think that's usually the easiest thing.
Sure.
It is a 4-year medical program. I learn everything that the traditional medical doctor learns. So pharmacology, anatomy, physiology, and on top of that, I get a ton more nutrition, herbalism, homeopathy, hydrotherapy, chiropractic, all the fun stuff.
Mm-hmm.
But the real tenet for us is understanding the underlying cause of something and addressing that. I always say we have plenty of Band-Aids, but I'd rather figure out why someone's bleeding.
Exactly.
Yeah.
So I think you've characterized this almost as being sort of a medical detective in some ways for an individual patient.
I always like to pride myself in being able to find what's going on underneath and addressing that. Yeah, so that's kind of my tagline, is calling myself a medical detective.
Mm-hmm.
Yeah.
And you treat patients with all sorts of conditions, or are there specialties in naturopathic medicine?
There are specialties. I kind of kept a broad scope when I was in school, focusing a little bit more on things like genetics. One of my mentors was Dr. Peter Diadamo, who wrote Diet for Your Blood Type, Eat Right for Your Blood Type. And he really taught me a lot about genetics and looking at how actually herbs and nutrients can sway the enzymatic reactions.
Okay.
So you can actually I don't want to say change the gene, but make them work differently with herbs, nutrients, and pharmaceuticals.
Okay.
Yeah.
Would another way of characterizing that maybe taking advantage of someone's genetic makeup to work more optimally?
I would agree, yes.
Okay.
And in controlling their environment to prevent any genetic mutations from triggering and turning on.
So as you said, the educational background is the same as any medical doctor would
Yes.
have. So where did you go to school?
I went to Bridgeport. It's one of the few schools it's actually the only school on the East Coast for
Okay.
what we do. And it's only one of 8 schools in the entire country.
Okay. Now, how did you first get interested in this field?
So I actually was a chemist for 6 to 7 years and struggled with anxiety and depression for most of my life. And when I lost my last chemistry job, I knew I didn't want to do it anymore. I couldn't afford to feed my fast food habit.
Mm-hmm.
And could only really afford broccoli and chicken, and realized I felt amazing on that diet.
Mm-hmm.
And then I came across this program online when looking at grad schools and just knew that this was what I was supposed to do for the rest of my life.
And what was your undergraduate in? Was it
Chemistry,
chemistry?
yeah,
Okay, all right.
yeah.
And so you kind of evolved into this from, I guess, a personal experience, as you just said.
Yeah.
And what were some of the things that you discovered along the way that kind of affirmed that there are, different ways of treating your body and taking more control over your own health?
Gosh, that's a really good question. Different ways that I affirmed it. Really just looking at other people's lives, I guess, and it was more me. I'm going to be honest. Doing a lot of trial and error and looking at, okay, if I ate this one day, how did I feel the next day? And looking at the patterns, which is any good scientist will do, is really looking at the patterns over time and seeing if there's any correlations. And I really did it mostly through me. And then as I became a student and went to school and we had clinical rotations, really seeing that same pattern in humans as well.
Mm-hmm.
Yeah.
So in your first year in medical school at Bridgeport, what
Yes.
were some of the courses that introduced you to this field a little more, in a lot more in depth than what you were familiar with before?
Sure. So actually the first year is more like a Yale Medical School program, Harvard Medical School program. It's anatomy and physiology and pathology. But what's awesome is they introduce the philosophy really early. Again, this idea of do no harm, treat the root cause, nature's cure. We believe that the body has an innate ability to heal itself. If you get a cut, as long as you keep it clean, it'll heal itself. Mm-hmm. So removing those obstacles to cure. So the first year was really more about learning the science and then slowly introducing the philosophy. And they did throw a little herbalism in there and botanical medicine, but it was really showing us that the pathology and the physiology and seeing the underlying causes. Really, pharmaceuticals didn't come till later in our education because I think they wanted to instill in us that, see this is how this works. This is where we can maybe adjust it and tweak it.
Okay, great. So, you're listening to Middlesex Moments. This is Steve Minkler talking with Dr. Sara Frawley, who's a naturopathic physician, and she's also an instructor here at Middlesex Community College. And after a quick break, we'll talk more with Dr. Frawley. Stay tuned.
I chose Middlesex Community College because of the location. Everyone's always willing to help, and they all just want you to succeed at the end of the day. Phlebotomy was my major, and what made me choose it was working in a group home and just seeing the pain that they went through. I highly recommend MxCC's continuing education program. This fast-paced course allowed me to get a phlebotomy job in a field that I love.
Welcome back to Middlesex Moments, coming to you from Middlesex Community College. I'm Steve Minkler, together with my guest, Dr. Sara Frawley, who is a naturopathic physician and instructor in biology here at Middlesex Community College. And we were talking about Sarah's educational background and what she had learned in medical school, and starting with what all medical students learn in terms of anatomy and physiology and pathology, and continuing in your educational journey. What were some of the courses that eventually became a lot more specific when it comes to the treatment of patients, treatment of illnesses, and all that?
Nutrition, mainly. I mean, we have 4 semesters of nutrition that really dig into each nutrient and what they do and what the deficiencies can cause, what symptomology presents with each deficiency. And then herbalism, botanical medicine, and looking at that. For my board exams, I actually had to memorize 300 herbs, their Latin names, and everything they did.
Oh, goodness.
Homeopathy, which is a very controversial medicine. For me, I've seen great success in using it. It is an energy medicine, which again seems a little hippy-dippy. But as a scientist, when I took quantum mechanics and thermodynamics in school, it actually made me more spiritual, understanding that everything has an energy property that can be adjusted and swayed and changed. So using homeopathy, I almost see it more as a quantum mechanic level and adjusting the energy on a cellular level. And then let's see, chiropractic. Some of the original naturopaths were actually chiropractors, so that's part of our training as well. We get a year of chiropractic training. And then,
So it's a wide variety of tools that are in your tool belt when you happen to see a patient coming to you.
Yes, I have quite a big toolbox, yes. And I always say this, I have patients that come back and the first thing might not work. And it's like, I got lots more things here we can try, so don't worry.
Good.
Yeah.
So I think that gets a little bit to that detective type of analogy that we were talking about earlier, is that as you working with a patient and really kind of getting to trying different things out to see what is going to work best for that individual based on their lifestyle, their physical makeup, their diet, their whatever stressors they may have in their life.
Absolutely, yes. It's very individualized, and that's what I love about our medicine, but it also makes it very complicated when it comes to research. We can't just say, you have this, you take this. It's very, very individualized, where that particular person has this because of this and needs to take this. So when you do things like double-blind studies with our research or with our medicine, it seems not to present itself as scientifically accurate. And that can be a struggle with us in showing that we are doing what we think is best based on scientific level.
Okay. Could you maybe walk us through the typical trajectory of how you would work with a patient? So let's say I'm coming to you as a new patient to you. How might you start your process in working with me in terms of finding out more about me, and then how might that run its course over the months and years ahead as we develop a doctor-patient relationship? Absolutely.
So the first visit with me is actually an hour long. We sit down and we talk about everything from your childhood to your stool, because it helps me to understand what's underlying and what's going on. The first meeting, I rarely give a supplement. I often am asking you to go get labs done, because again, that's that detective in me wants to see if there's something there before we start guessing. I would rather have an answer and say, okay, this is what's causing this. This is why we're going to take this. And then I might slowly start to tweak your diet. And it depends on the person. So if they are eating junk food all the time, I'm going to have them have one day a week where they cook their own meal. If they are eating well most of the time, but I see there's one inflammatory food in there, I might say, hey, give me 2 weeks and I'll remove this. This is usually my timeline. I say, give me 2 weeks. Give me 2 weeks of this and see how you feel. If you don't feel, a difference after that, then we'll change it up and we'll try something different. I seem to find that 2 weeks gives them, it's not too much. It's not overbearing, so they can actually do it and succeed in it. And then usually they see some benefit in that 2-week period. Follow-up visits are half an hour, if not longer. Sometimes they're longer if we're chatting. And that's where I really try to do supplementation and try to improve their ways of life. And it's a slow progression. Most of the time people see me a lot at first, and then it's up to them. My job as a teacher, and that's kind of why I love to teach. My job as a teacher, it's to teach them how to heal. I'm just the coach. They're doing all the work.
Okay.
Yeah.
Yeah, I think that's really an amazing perspective to think about it. Now, I will confess that I have not seen a naturopathic physician.
Most people haven't.
So you're really encouraging me to look more into this.
Good.
Truly, because I think that, as you said, it's a matter of not for a patient or a person not to just rely on someone giving them all of the answers.
No. This is a life change. Yeah. This is not a fast thing. This is not a quick diet. This is changing your life as a whole. So this is mind, body, and spirit, right? This is, yes, changing your nutrition, but if you're stressing all the time, it's not going to matter because then you're going to stress eat, right? So it's also looking at how to de-stress properly. I talk a lot about acceptance in my practice, accepting where you are and what you're doing, because if you can do that, then you can make that change.
Okay. Yeah. And there's a lot in the world of medicine that talks about the person's primary caregiver, which you would be in your patient's case, correct?
I'm actually a specialist in the state of Connecticut.
Okay, so how does that work in terms of being part of a team of medical professionals that surround a patient?
And I think that's very important that we have a team of medical professionals because I can't know everything and they can't know everything. Right. It's more of a specialist here in Connecticut. In Vermont, we're actually primary care doctors. Okay. It's very state to state. We're actually only licensed in about 20 states in the country. So it's very state to state and how we practice. Some naturopaths in the state do practice very as primary. I'm more the person that you've seen 13 doctors and no one can tell you what's wrong with you. And I'm the one that figures out what's wrong with you. That's usually where I like to pride myself. And that's what I was trained for in the state of Connecticut because, again, we are specialists here.
Right. In my own experience in talking to friends who have sought relief from things that have bothered them with their health, I think one thing that comes to mind are some friends of mine who have an aversion to gluten.
Yes.
And I think now that's become a more commonly known that there's a gluten aversion. But I think when that was a little bit when it was emerging as an issue, most of the people I know sought relief from a naturopathic physician. It was just, but the process that you described helped pinpoint that.
Yes, and it's not only gluten. There's a lot of different food sensitivities. I personally am severely allergic to dairy.
Okay.
And corn is not my friend either.
Okay.
But I can get away with wheat. And again, so it's not everybody should avoid wheat. It is very much what food is your inflammatory food and finding that, which is a little tricky. There's blood work, but it's not the most accurate in the world. Again, it's more elimination and, trial and error there and figuring out what's right for you.
Okay.
Yeah.
So one of the challenges you must face is, as a practitioner, you operate a practice,
I do.
A medical practice.
Yeah.
And what was that transition like from medical school into kind of getting your start and now running a successful practice?
It's challenging because as scientists, we're not business people. And also as naturopaths, we don't go to a hospital and get a job. Right? We have to build our own practice. Luckily, I started with a doctor in Wallingford who's had a practice for, I don't want to say 20 years. He would be mad at me. I think 15 years.
Okay.
And so he kind of helped show me and introduce me into the world of private practice. And then I recently, last April, not so recent, broke off and started my own. It's tough. It's a lot of business. It's a lot of self-promotion, which I think people don't understand. Which nowadays is not so much print advertising. It's more what we're doing here and social media aspect of it, which is, again, very difficult for scientists because I think we're a little more introverted and can be tricky to put ourselves out there at times.
Well, you don't seem too introverted to me being on this show. So
I had to learn this. This is a learned extroversion here. But I was a chemist. You know, most of us are very introverted. And it's more learning when to be extroverted and finding that balance, because you have to be when you're sitting with a patient on some level. You can't just be completely internalized. You have to be present with them in that moment.
Okay.
Yeah.
In terms of promoting your practice and promoting the services that you provide to patients, I think maybe talk a little bit about some of the skepticism that the public may have about naturopathic medicine. What are some of the, I hate to call it this, but what are some of the selling points of why someone should come to see a doctor?
Well, I want to start with the idea that, again, we're not licensed in every state.
Yeah.
So in certain states, you can go online, and I think it's a 6-week course, and call yourself a naturopath. But they're not naturopathic doctors. So I think that starts some of the skepticism and confusion. So they're finding these people that, call themselves naturopaths, but only have a couple weeks of training compared to my 4 years, which was, we averaged 24 credits a semester. We had 14 classes a semester. So I think people are confusing, and that's where the skepticism is there a little bit. We also have some naturopaths that don't practice the way they should. I don't like that. They don't practice the true medicine and haven't found success in it. And for that reason have come back and, as naturopathic doctors, have criticized the profession. So I think that has created some skepticism as well. As for selling points, I really think understanding, and every naturopath is different. Every doctor is different. Every MD is different. Every chiropractor is different. Every physical therapist is different. I think you need to find the one that's right for you. Some of us are a little more shamanic. Some of us are a little more spiritual compared to someone like me that's a little more scientific. So I think it's really important to interview your doctors and find the right ones for you. And I always say this to my patients that might be seeking out another type of specialist or a primary care. I say, talk to them, ask for 5 minutes. And if they don't give you 5 minutes, they're probably not the right person for you. They're probably not the right person for anyone. If they're not going to willing to talk to you on the phone for 3 minutes to see if you have a good back and forth, because I think that's really important.
You see patients of all ages.
I do.
Do you see some shift based on the age of the patient in terms of asking those questions? I think, just again, personal experience. I think people who are a little bit older, thinking of my own parents, just leave everything up to the doctor. Don't ask those questions.
Yes, absolutely. Yeah. And it's more I adjust to the patient at times. We talked about this in school, and it was a little controversial because, again, we are a little more hippy-dippy, that a lot of us had multiple piercings and visible tattoos, and there was a conversation that you need to adjust to the patient, that there are going to be those patients that aren't going to understand that just because you have a nose ring doesn't mean you're not intelligent. So it's really important to adjust your dialogue and conversation and introduce things slowly. So yes, there is more. I often not necessarily start with the fact that I have a Reiki 2 training, because it's not necessarily scientifically proven. I often start with my chemistry foot to kind of introduce myself and then slowly progress towards more of the energy medicine.
Okay, super. Well, Sarah, it's time for a short break. Okay. So when we come back, more with Dr. Sara Frawley and me, Steve Minkler, here on Middlesex Moments from Middlesex Community College. Welcome back to Middlesex Moments, coming to you from Middlesex Community College. I'm Steve Minkler, together with my guest, Dr. Sara Frawley, who is a naturopathic physician and instructor in biology here at Middlesex Community College. And before the break, we were talking about her medical practice and how she treats her patients and how a doctor-patient relationship develops in this field. And I think maybe to kind of wrap some of that up and summarize some of that, I think we were talking about sales points for naturopathic medicine.
Yes.
And I think from what you were describing, it sounds to me, if I had to help you sell it,
yes, please,
is, again, standard medical training, scientific method training, but also bringing in different aspects of how we live to look at the whole person in a different way.
Yes.
But that because the process that you utilize is very thorough, you still have results that absolutely help the patients that you work with.
Absolutely, and they're healing. That's, I think, a big difference as well. When if they're willing to do the work, because again, I'm just the coach, right?
Mm-hmm.
They're doing all the work. If they're willing to do the work, they will truly heal. It's not just so much staunching the bleeding, putting a Band-Aid on it. They're going to truly heal, and I think that's really the selling point of naturopathic medicine. Again, you have to be willing to do the work, though, and I think that's something that we really need to understand, that this is a whole process, and it's okay, and we'll walk you through it, and we'll be there for you as you go through it, because it's not an easy thing. But if you want to feel better, you got to do the work.
Mm-hmm.
Yeah.
You also were saying that when you develop a relationship with a patient, that you suggested that all patients should interview their doctors.
They should.
And what are one or two key questions that you would advise our listeners to ask if they are interviewing a new doctor?
I think time is really important. I would ask how much time they spend with their patients, and their approach. I think that's really necessary as well, because we all get training in all your diseases. So it's not, have you treated this? Yeah, we've treated it. That's not your question. Your question is, how much time are you going to spend with me? How much time are you going to spend on me? And what's going to be your approach? I think that's very, very necessary.
Okay.
Yeah.
So let's transition a little bit to how you came to Middlesex Community College. What got you interested in teaching biology here at the college?
So I actually have credits from Middlesex from, I think, my sophomore year of high school. I grew up in Meriden.
Mm-hmm.
I am a student. I went to Maloney, so I think my Algebra 2 class was actually credits through here.
Okay.
And then my mother and father actually went to community colleges. My mother went to Tunxus, and my father went to Northwestern Connecticut Community College. Both beautiful schools. I was actually the first doctor in my family. They were the first people in their families to go to college.
Okay.
So community colleges have been a part of our family for as long as I can remember. When you get out of naturopathic medical school, again, you don't just join a hospital. You have to grow your practice. So what's nice is we have these opportunities through the community colleges where we can pick up a side job to have a nice steady income while we're growing our practice. And so I have always enjoyed teaching. I grew up being a camp counselor and a babysitter, and I have always enjoyed this. And as I mentioned, I have a little acting background too. So it actually, what I wanted was somewhere to have that outlet. And I came across that you guys were looking for biology professors, and I applied, and you guys were nice enough to take me on, and I think I'm now in my 6th this semester here.
I think so, something like that. Yes,
Yeah.
that's right.
I started with regular biology, and the ultimate goal was to get me into human biology, and that's where I am now.
Okay. What do you enjoy most about teaching?
Gosh, to be honest, spreading the word of naturopathic medicine. What's really neat is I'm introducing the concept into the program. So yes, I'm teaching everything they need to know. I'm teaching them their anatomy and their physiology. But on top of it, I'm talking about things like when we go into endocrine and we're looking at the negative feedback loop of the thyroid and talking about diagnosing the thyroid. We're also going into, okay, what are the key nutrients that you need for a proper thyroid function? So I'm slowly kind of introducing this idea of scientific theory to them through naturopathic medicine, and seeing the kids thrive and really enjoy it. That I think has been the most rewarding thing for me.
The students in your classes, are most of them interested in a health career profession, or are many of them taking it just as an elective?
It's just an elective. These are all non-science majors. Okay. So I'm trying to make it interesting for them. So when at the end of this semester, they have a paper that's due at the end of the semester, I allow them to explore their own degree in the biology realm. So they're allowed to find a concept that they're interested in based on their degree and what they're studying, as long as it's somewhere in the biology realm. So a lot of my students are psych or sociology majors, so I'm allowing them to look at neurochemistry and understanding the underlying balances of neurotransmitters when it comes to mental health and anxiety. So that has been a common paper, actually. And I actually just had a really good paper on looking at nutrition in schools and how that affects scholastics.
Oh, interesting.
That was a really good paper, yeah.
Okay. Well, I think I would encourage you and your students. I don't know if you're aware, but we have an academic convivium here at the college every spring. So
I try. I
Okay.
push it, yes. Well, I also tell them that they're doing this as a starter for their own major. Use this paper later. You can present this as a poster or as a paper in your own profession later. So start this, use this as an underneath and just kind of grow from here. Yeah.
And what's some other advice that you might give to the students who are in the class who may be taking the course as an elective, but sort of a spark goes off? Do you see some of that happen with some of your students?
I do, and so they're incorporating it into their own lives. It's not necessarily they're going to use this as a profession, but they're starting to use it into their own lives. I often notice sometimes their diets change, and they also start to see what I see in it. So they're starting to point. All right, so this is happening. Why is this happening? And I think that's really the important thing that I'm instilling in this program. It's not so memorize this. It's okay. Look at this and then understand this pathway so you can see why this might be occurring. So I think they're using that in other parts of their lives, but they're using it in their own health and in their family's health.
Great.
Yeah.
Great. What kind of connections might you see between the college, the course that you offer, and what the students might be able to do perhaps in the community? Our college is very committed to civic engagement and community awareness. Are there some possible connections you might see?
Absolutely, because I think, especially when we get to the nutrition realm, I think that's a huge aspect. It's really, I think the act local. Act local, think global. Think local, act global.
Right,
yes.
Yeah.
I think understanding that how nutrition has a major impact on the entire body, including the mind. I think those students that are going into sociology, going into psychiatry, are going to have a better understanding that if they can help someone adjust their diet, that their lives are going to be better total. And speaking of that paper, that student actually went and spoke to principals.
Great.
And I believe there was a local school that did a trial of doing like breakfast in the morning and went and spoke to them about getting information. So yes, they were reaching out and understanding how the community is affected on a nutrition level, which I can tell you one of my hardest jobs is working with kids who have to eat food through the public school system.
Yeah.
It's one of my biggest trials.
And why is that?
Because the food's awful. I shouldn't say that.
Well,
They're feeding them simple carbohydrates,
Yep.
which we burn through very quickly, and then expect them to pay attention afterwards. And that's it doesn't make sense.
It's calories and not nutrition at that
Yes.
point.
Yeah.
Or quick energy to get you awake in the morning, but then
Yes.
it fades very fast.
Fades
after
very
that,
quick.
Sure.
There's a lack of protein, which is our sustaining energy, of more complex carbs, which is our sustaining, and we're working towards that. We're getting there, but it's still lagging behind.
Okay. So there's a potential opportunity with perhaps your students in the college to help educate school systems in that connection between nutrition and readiness or awareness, preparation for school.
Yes, I would absolutely love that.
Okay.
Yeah.
And as I think you're suggesting too, is that even with a community college, we offer associate degrees. We're not research institutions like
Yes.
perhaps a UConn is, but how important it is for students to begin thinking about good research. They may be scientists, they may be doctors someday, but
Yes.
even research in terms of your daily life. Just don't take it for granted what you're seeing and the first time you read an article about nutrition, for example.
And not even nutrition, but think of all the articles on social media that are obviously bogus. And I teach that in the class, is looking at where are those resources coming from? Is this an opinion piece? Right? Where are they getting this knowledge? And so they have to do that when they're writing their paper. It's only peer-reviewed journal articles coming out of that paper. The points get deducted if they're posting anything from, I always say Dr. Axe, but from any site that isn't peer-reviewed journal article.
Okay.
Yeah.
I would imagine you give the similar advice to your patients if they're wanting to take more control of their own health.
Absolutely.
Where you might not refer a patient to a peer-reviewed journal, or maybe you would, or what
I
kind
do.
of? Okay.
I do.
Right.
I just PubMed, which is a really nice site, only has peer-reviewed journal articles. What's nice here at the college, you guys have plenty of journal articles available through the library, which is very, very helpful for research. No, I do. I am pointing towards that. There's some really good naturopathic articles like the NMDR, I believe, magazine. That one's lovely. That is a lot of research-based articles. But yes, no, I'm pinpointing and showing people, this might not be the best thing, and showing them where to find the actual research. Yes. Books, too. I'll usually point out some very good books for patients specific to what they have going on.
Okay.
Yeah.
And as our time's kind of running out here, maybe just one last question for you.
Sure.
When you're not running a medical practice or teaching students at a community college, what do you do for fun?
What do I do for fun? I actually I learned to snowboard last year.
Awesome.
At 35. So I went about a dozen times last year, and I've already gone twice.
Okay.
I'll be going next weekend once it snows again. So that's usually what I do in the winter. I actually just rescued a dog as well.
Oh, cool.
And Sandy and I have been hiking quite a bit in the last month since we met.
Great.
As you can imagine, I'm very outdoorsy, and so
Definitely.
hiking, camping kind of thing. But I'm also a film buff as an old actor that I've, really pride myself. I just started writing for on-stage blog and looking at enlightenment and life lessons through entertainment, through movies and television.
Oh, excellent.
Yes.
Wow, so you are a multifaceted person
I
here.
try to be a little Renaissance kind of action happening.
Definitely.
Yes. Yes. Very much.
Well, Sara Frawley, it's been a delight to meet you and to have you as a guest on Middlesex Moments. I thank you so much for joining me today.
Thank you for having me.
And our listeners and viewers, if you're interested, Sara teaches biology classes here at Middlesex Community College, and it is time to register for the spring 2020 semester. So please keep her in mind if you're looking for a biology class at a community college. So I want to thank Sara for joining me, and thanks to all of you, our listeners, for hearing another edition of Middlesex Moments. As always, you're welcome to visit us in person at our main campus at 100 Training Hill Road in Middletown, or at our Meriden Center located at Platt High School at 220 Co Avenue, where you can take classes in the afternoon and evenings 4 days a week. And of course, you can visit us online at mxcc.edu. For everyone here at Middlesex Community College, I'm Steve Minkler, and we hope to see you again soon.